Welcome. This is a video explainer on health equity in Connecticut. This is a project of the Connecticut Healthcare Explained. I am Haley Magnetta, a fellow at the CT Health Policy Project. In simple terms, health equity can be described as giving every individual the opportunity to be as healthy as possible, regardless of race, ethnicity, gender, sexual orientation, or disability status. However, this should not be confused with equality. It is critical to recognize the unique and different needs or resources a person or group of people needs to thrive. Health equity is not simply offering all individuals the same opportunities, but working to eliminate the disparities within a population to allow everyone to be as healthy as possible. For example, only focusing on health equality would mean that every patient with a disease is given the same prescription. Health equity would focus on ensuring every patient with the disease gets the prescription that works for them and has the same resources and opportunities to both receive the prescription and understands how to take it properly. In this scenario, health equity focuses on the need for each patient to be able to afford the prescription, have appropriate transportation to pick up the prescription, have access to the healthcare provider's office, and receive understandable instructions about how and when to take the prescription in their language. The groups most vulnerable to inequities are people of color, women, people who identify as LGBTQ, and those living with disabilities. Connecticut is not immune to disparities. While disparities are harmful to individual and community health, they are also costly. It is estimated that disparities cause an extra $384 million in hospital costs for Black state residents and another $121 million for Connecticut Hispanics. Connecticut's State Health Improvement Plan, called Healthy Connecticut 2025, is focused on improving equity and eliminating structural racism. So let's discuss those populations who are most vulnerable when considering health equity. When we consider the Black population, the Black infant mortality rate is over twice the rate for whites in Connecticut. Moreover, with regard to the Connecticut Hispanic population, Hispanics are twice as likely to lose a limb to diabetes as whites. Connecticut Hispanic children and youth are 4.5 times as likely to visit an ER for asthma. While racial inequities play a role in health disparities, race is not the only contributing factor. A 2022 Connecticut survey found that 16% of respondents were denied health care due to their LGBTQ+ status. And Americans with disabilities are twice as likely to be in poor health and half as likely to get a checkup. What's more, multiple studies have documented resistance among physicians to caring for patients with disabilities. Gender also contributes to the disparities we see in Connecticut, where women in Connecticut are more likely to be in poor physical and mental health than men. Connecticut women are also have the 4th highest rate of breast cancer among all states. So where do these vulnerable populations and health inequities stem from? While there is not one specific answer, the social determinants of health do play a large role in health equity. Social determinants of health are the conditions in the environment where people live, work, play, learn, and age that affect health outcomes. Social determinants of health reveal the interrelated aspects of health inequities that lead to poor health outcomes. Recognizing and working to improve social determinants of health are very important because an individual's overall health is determined far more by their social determinants rather than the medical care they receive. Researchers estimate that medical care contributes only 16% to our health outcomes, while socioeconomic factors such as poverty or someone's education status contribute 47% to an overall health outcome, and where health behaviors such as smoking or alcohol use contribute 34% to one's overall health outcome, and one's physical environment contributes 3% to their overall health outcome. Here are some more specific examples of how social determinants of health can impact one's health outcome. It is no surprise that economic instability would directly impact health outcomes, and we saw that 1 in 10 Connecticut residents lived in poverty in 2021. For example, when one suffers from economic instability, they may have to make the difficult decision of paying for their rent or for paying for their prescriptions. Moreover, we see racial inequity within economic instability, where Blacks and Hispanics in Connecticut were over twice as likely as whites to live in poverty and therefore can experience higher rates of poor health outcomes. It is also no surprise that having access to nutritious foods is critical to staying healthy and allowing the body to heal. Food insecurity can be defined as someone who is unable to afford food at least once in the last 12 months. In Connecticut, 10% of white, 23% of Black, and 28% of Hispanic residents are food insecure, which can lead to poor health outcomes. And finally, it is hard to be healthy without safe, affordable housing. Barriers to affordable and safe housing can negatively affect health by exposing individuals to harmful environmental conditions in the home or neighborhood and limiting the available resources that they may have had to use for food, healthcare, or education. Over 1/3 of Connecticut residents spend more than 30% of their income on housing, where Black and Hispanic Connecticut residents are 33% more likely to spend over 30% of their income on their housing. When one is forced to spend greater than 30% of their income on housing, they often have challenges affording healthy foods or paying for medical bills or supplies. Additionally, one's physical environment can impact health outcomes. For example, in Connecticut, children who live in urban areas experienced a 6 times greater rate of lead poisoning than children in suburban communities. Lead poisoning in early childhood, when rapid neurological development takes place, is a serious danger to a growing child with profound effects on their health outcome. So, what can we do to help combat these health inequities? There is ample evidence that diversity among healthcare providers supports improving equity for underserved populations. Unfortunately, Connecticut's healthcare workforce does not reflect Connecticut's population in race and ethnicity. When looking at the graphs presented here, we note that whites are overrepresented, while Blacks and Hispanics are underrepresented among physicians, advanced practice nurses, physician assistants, registered nurses, and dentists. While there is much to learn, there are policy options that can improve equity. Proven public health interventions are key. There is a great deal of research identifying public health interventions that are proven to reduce inequities, improve health, and lower total healthcare costs. Among the most effective are tobacco control, food safety, reducing infections in healthcare settings, reducing motor vehicle injuries, reducing teen pregnancies, and improving nutrition, physical activity, and lowering obesity rates. Searchable databases have made it easy to prioritize initiatives and identify best practices. There is help for state policymakers in using that research to implement proven interventions. Connecticut's Department of Public Health has also created a health equity toolkit for local public health departments with resources and their practical tools to help understand health equity and include it in their work. Connecticut's Medicaid or Husky program also has information and resources for providers, including assessments and other tools to identify and address the drivers of inequity for their patients. Disparities can be unintentionally embedded in policymaking. Without conscious and vigorous effort to address biases, those disparities will be perpetuated into the future. For 2023, the Connecticut Health Foundation has developed recommendations for policymakers to promote better health for all, including underserved communities. The recommendations include expanding coverage, care coordination to promote prevention and manage chronic health problems, engage community health workers in their communities to improve health, and take care in unwinding COVID protections and expansions of coverage to mitigate harm. There is a special concern that as more payers use health technology assessments to promote value in the healthcare system, that health equity be incorporated into the methods to ensure underserved communities have fair access to innovative new treatments. Health technology assessments are evidence-based evaluations of healthcare treatments for clinical effectiveness and fair pricing. Health technology assessments ensure the system rewards innovations that significantly improve health with fair prices. Consulting with experts and patient advocates, the Institute for Clinical and Economic Review has developed standards for entities assessing clinical effectiveness and fair pricing in the United States and beyond to promote health equity for disadvantaged groups. And finally, researchers have identified policy and practice solutions to help diversify the workforce. These practices include cross-educational, financial, social, and institutional supports that can improve diversity in the healthcare workforce. Hopefully, this has helped explain health disparities and health equity in Connecticut. For more information, visit our health equity chapter in Connecticut Healthcare Explained, which can be found at cthealthexplained.org.